Be cyber smart.
A very good morning and welcome to Kusile Breakfast Show. Sakuvusela la usibukela khona lo mhlahlelweni Kusile Breakfast Show sakuvusela sakumukela. It is the 10th of August 2023. Welcome. Angikho ngedwa ke nginemnguni lapha eceleni kwami. Sifisa, how do you do this morning?
Ngiyaphila, kunjani Mfombe?
I'm great. I'm well.
Doing very well. Just excited for the fact that my temperatures are a bit higher than yesterday. Angivani nemakhata Lulu. You should know that. Angivani nemakhata. But yeah, we're waking up ku 9 degrees Celsius. Expected temperatures letawukhulela kuwo 19 degrees Celsius, just 2 degrees higher than yesterday. Akusho ke lokho ukuthi kuyashisa namhla solo nje kumakhata. It is advisable ukuthi ke usaphuma usahlungisela ke M17 uliphathe lelo jezi noma leso silamba ukuthi utaba protected from imikhuhlane lengabe seseya bangeka ngawo emakhaya. A very good morning to you. A very good morning to wonke umuntu ke losijoyinako emakhaya. Whether you are outside of the country noma ulapha kaNgwane siyakuvusela. It is your perfect recipe to start your day. Lomhla ke ehlelweni sita ukhulumisa na nebaka the clinic group nge-asthma, which is a major non-communicable disease according to the World Health Organization, which affects both children and adults, and is the most common chronic disease among children. Asthma is affected an estimated 262 million people ngeminyaka wa 2019. Kanti ke kwafa abantu labalinganiselwa ku 455,000 ngayo ke i-asthma. Kanti ke most asthma related deaths occur in low and lower middle income countries where underdiagnosis and under treatment is a challenge. Njengabe simephi thine silive la kaNgwane njengoba ke World Health Organization is committed to improving the diagnosis, treatment as well as monitoring of asthma to reduce the global burden of NCDs, as well as to just make progress towards universal health coverage. Dr. Chihaya Frederick is a general practitioner with the clinic group. He will join us later on the show through a video link. Kusipha nje sithombe ekutheni simephi masikhuluma ngabo treatment nabo diagnosis la kaNgwane, nekusipha nje sithombe sokuthi ini vele i-asthma uyitreata kanjani, what are the symptoms of the asthma. Don't go anywhere.
Right, stop sikhulumisane nalabasuka aka Eswatini Investment Promotion Authority nje kutakhumula ukuthi mhla ka 1 September kutaqala yona International Trade Fair. Stop sikhuluma nje kabanti ngemoto letawinwa this year. One lucky visitor will win the popular SUV, the Kia Sonet. Nanzi to enter the competition amaswati kubhe ukuthi avakashele i-International Trade Fair letaqala mhla ka 1 iye kumhla ka 10 September. Baphinze bavakashele nje nema stands la khona trade fair and also gather stamps on their entry forms. The entry form should then be dropped into the entry box. The winner will be announced during the EITF closing ceremony. As FNB Eswatini has also sponsored the trade fair ngemali lenganga 200,000 towards the competition through their subsidiary West Bank. Inkapanike Kia Motors now is also sponsoring the remainder of the car's value to make the competition a reality. The car's value currently stands at 380,000 malangeni, which means healthcare sponsorship currently stands at 180,000. Sithabe sinaye-ke lapha external manager ka-APAS Busiso Mnisi athi sitiketa nje sithombe esawo lo msebenzi walonyaka kuva nje kabanti nange-program yokuthi yini lesingayibheka kiyo umncintiswano noma ke umbukiso we-International Trade Fair. Sakhumbula ukuthi kade sawugcina ngetiza futhi emkhuhlane COVID-19 sifuna kuva ukuthi yini abayingetile yini abayisusile kulonyaka.
Yeah, and I think it's a good opportunity lulunje kubuka emazinga bakhicidi bethu la kangwane dingapanje ngoba sibonile ukuthi nemvuna ilitiko la commerce manquba khumalo phakamisa wona ema awards equality kuqinisekisa nje ukuthi vele siyakhona ukuchutselana nedingapani temhlaba uma sesithengiselana ke nalamanye emave emhlaba kakhulu nje kumcwa kakhulu lokho sibuka nabo African Continental Free Trade Area laba siniketa yona insayale enkhulu ukuthi salo sithengisa ngaphandle kwelive la kangwane sithengiselana nalamanye ke emave la khona libekatini leAfrica as well as the whole international community at large. Siyafuna ke kuyobona kuye trade fair ekuthini such developments simephi kuwo kulesikhatsanyalo. We do have our leading headlines emaphephandabeni lesitawabuka masinyane.
Alright, saqala ngekubuka iTimes of Eswatini lomhla ngolesine ukuthi ihlolo ithamba embili dithini. Let's look at Times of Eswatini. After companies sold to Inyati, 200 MB venue workers demand 17.2 million benefits. Nature's Kanya Mabuza is New Health PS. RSE destroys 136 guns, 11,000 bullets. Cabinet's last day in office has been revealed.
Kanzike kutemidlalo ku Times of Eswatini le hamba embili ikhulumisa ke iBuffalo that is withdrawn from ICAF in what can be viewed as an unexpected move. Kanzike lenye le hamba embili imbube marathon package now stands at 660,000 emalangeni following sponsorship package for the Imbube marathon that has gone up to now 660,000 emalangeni after various companies came on board in support of the race yesterday. Bona Standard Bank aphakamisa ishekela 350,000 emalangeni. Kanti-ke lenye lehamba embili Mopina Caleb in second transfer clash. This one speaks to Mbabane, the coach picks the players who he wants to play. So if he doesn't like you, it's best to stay away. Kanti-ke in the international front, Temidlalo Lukaku back at Chelsea training. Quite an interesting one. Kanzikelenye Itzi Downs beat Chiefs. Sundowns get a Sashai Kaiser Chiefs 2-1 Epitori.
Asibuka ke iEswatini Observer this Thursday le indaba lethamba embili nje kulo phephandaba yeEswatini Observer on page 2 Nature Boss New Health PS Ministry kanti ke nasivakabandi Dr. Simon Zwane has been transferred to Housing Ministry. PM uthi transfer of PSs is normal every 5 years. Bulletin lethamba embili kubene car accident itolo lapho khona 2 people were admitted as Kumbi overturned. Kulonye lehamba embili on page 3 King extends cabinet stay. Bulletin lethamba embili Nzevane factory to create 1,700 jobs.
An interesting development there Nzevane sabajabula ke sibatha ukufala emathuba emisebenzi kanti ke sibafisela ne speedy recovery nabala balimele kule ya Kumbi overturn. Kutemdlalo ku Eswatini Observer 7 Dreams players in dilemma. Team has not started pre-season training. There's no communication from authorities. Players contemplate looking for greener pastures, and the team occupies basement position in Momo Cup voting. Eswatini Observer kutemidlalo Imbube marathon sponsorship package rises to 660,000 emalangeni. NPF staff and the various corporate companies who donated 130,000 emalangeni towards this year's Imbube marathon are seen on that picture there kubanjwe emashege. Kanzike kulenye lehamba embili it's teams closing in on 30 million votes. This is a development leyendeka kuMomo Cup voting. Leto ke lethamba embili maphephandabeni ethu lomuhla ekuseni.
Yeah, 9 minutes after 6 o'clock sabahlete magazine asibuya sathatha indaba yethu eSwati.
Umsakazo wetithombe iEswatini TV utibophelele kuhlonipha nekulandzela umgomo wetekusakata loweluswe libandla letekuchumana eveni.
Ngephansi kwalo mgomo sitimisele kusakata tindzaba letenteka ngaleso sikhatsi tindzaba letide emagama lacosheme letitsembekile letitsintsa tonke tinhlangothi naletisebaleni
kusukela kutepolitiki, tetemphilo, tekulima, tetinkantolo netemhlaba wonke jikelele siniletsela tindzaba njengoba tinjalo ngaleso sikhatsi letenteka ngaso.
Kanzi kulo msakato siphinde sikulethele lonke luhlobo lwetemidlalo kusuka emidlalweni welibhola letinyawo kuye emidlalweni ledlalelwa ematafuleni kanye naleto letiqhamuka ngaphandle kwakuleli.
Leti tindzaba lowutiletselwa ngumsakazo wetithombe iEswatini TV.
Mizuzu leshumi kubumbene insimbi yesithupha ngwanelo muhle sithathe nathi tindzaba. Khanya amabuza lebeka ngumphathi welibandla lelilwane eligciwane le-HIV kanye nesifo se-AIDS iNature senguyeke emabhalane lomkhulu etiko letempilo. Lokhu kulandzela ukuthi yabulawe ingonyama inkosi iMswati wesithathu ngalesibili kuleli viki.
Ngekugunyatwa ngomthetho sisekelo welive laseSwatini isiqephu se-78 ingonyama emhlaba inkosi iMswati wesithathu seyibulale bomabhalane labakhulu bematiko ahulumende. Ingonyama ke ibe seseyithuma ndunankulu Cleopas Dlamini ukuthi ete atawonda lesimemetelo emhlabeni.
Ingonyama ke sesithume ukuthi sitomemetela ukuthi seyibulele Dr. Simon Zwane ukuthi ayoba principal secretary etiko laka housing kusho ukuthi usuka etiko laka health. Ingonyama ke ibe seyibusisa Khanya Kwezwe Mabuza ukuthi ayoba principal secretary etiko laka health. Khanya Kwezwe Mabuza ke kwamanje CEO waka Nature lapha badilisha khona nge-HIV Mabuza ke so uyawuba principal secretary.
Insele enkulu lebhekene nelitiko letempilo kuletinsuku yindzaba yekwesolakala kwemithi nemaphilisi etibhedlela nemtholampilo yahulumende. Lena ke indzaba lekumele ukuthi Mabuza atsangena nje ehhovisi avele akholetikwayo ngekushesha ayibambe ishisa. Umbiko ohlanganiswe nguLinkedIn Gule nginavuma inkosi Nzinisa naSifiso Ncumalo sisemahhovisini endvuna Tembuso eMbabane.
Liphinile ndvunankulu imphunga Themba Masuku lithi kungumfalo wawo onke eMaswati kuthi akhulise bantfwana ngenhlonipho nangendlela letokwenta ukuthi babambelele emasikweni abo. Masuku kusho lokhu emcimbini wetemasiko wesikolo lesikhulu saseLangeni.
Emasiko ethu nemihambo ngikona kusenta sisekele bukhosi lobungibona sikhungelwe kuwo. Ngeke nje ubusekele ngesingisi, ngeke nje ubusekele ngokungahloniphi, ngeke nje ubusekele ngekungasihloniphi nemithetho. Uthi ungavuka nje ekseni uhambe uye lapha emoneni ubite abantwana labancane uthi anikhulume indvo leluhlata, fundzise bantwana tindvo letingafanele letingengangaphi. Ngiyabekisa lokho ngilokungahloniphi.
Sihlalo welibandla lelibuke kuthuthukisa kwelilwimi lesiSwati inkosikazi Thandi Khumalo ithi sive lesilahla imvelaphi yaso asinalo lekusasa lelikhosako.
Nasithi umuntu usive ngelisiko lakhe, aphindze abe sive ngelulwimi lakhe, aphindze abe sive ngendlela lembathe ngayo, aphindze abe sive ngendlela lenta ngayo tintfo. Pension yethu lengumlibalo ya embili sikufake lokuthi bayati labantwana imvelaphi yabo kuze kuthi kusasa noma ngabe sebaphumela ngaphandle bangakhohlwa buve babo.
Losebambe kuba sikhulu saseLangeni inkosatana Thembeni Magongo uthi wonke umuntu losemangweni kufanele ayinake indlela labakhula ngayo bantwana.
Bantu bafika esigabeni la besaba khona ngisho ukukhuluma ngathi kwenziwa yini. Bengiqhubeka mina ngibambe imhlangano besiqhubeka sisebenza lapha RA besabafuna abantwana kufuneka umhlanga kuthiwe bayesaba labanye bakhiphe nkosatana qale kuthiwe khipha 80 gcina sekuthiwa hayi khipha nje 100 utameke uvala tikhala nenda njalo mhlonishwa labantwana labanye nje ngikhuluma nje bakhona khona la bayangiva ukuthi besigiya ngabo sisive semaswati.
Sikolo saselangeni sigubha lelilanga nje lomuhla umhlaba ubungata lilanga lebantu benzabuko njengoba labanyende emhlabeni balahliswa emasiko abo ngesikhathi imibuso yamandla ngengwenya ithatha imave abo. Sicubulo sekubungata lelilanga lonyaka sithi bantu bemdzabu labasha bangamahlandlela ekwenteni tinguquko letiqinisekisa lwati kanye nengqubekela phambili yabo. Etindzabeni te-Eswatini TV kubika Mbongwa Dube nasebenele Mthethwa elangeni.
Liphini Mvunankhulu Themba Masuku lithi umthandazo lomkhulu ukuthi tinyuke tinombolo tabothishela labanenhlitiyo yekufundzisa. Masuku abekhuluma amelelwe ngilobeka ngamele indlu yetimphunga Lindiwe Dlamini emsebentini wekuvalelisa abothishela esikolweni lesincane esandleni.
Liphini Mvunankhulu lihlanganyele nesikolo esandleni primary school emsebentini wekuvalelisa abothishela labatsatfu lesebatsatsa umhlala phansi. Lomele liphini Mvunankhulu lekungulobeka ngamele indlu yetimphunga Lindiwe Dlamini ukhutsata abantwana besikolo ukuthi bahloniphe batali babo ngoba nguloko lokuyawubaphumelelisa.
Umthandazo wambothishela ukuthi we can have more teachers labanenhlitiyo yale teaching profession. Utokwati ukuthi lele sesikunike kona lokubantwa bethu sibalethe etandleni takho. You know, you can mold them or you can destroy them. You can build them or you can destroy them. Whatever you plant in these children, in future, we are ubuke muva ubone kuthi naye imsebenzi yakho.
Munye wabothishela labavaleliswako Bongani Ndlangamandla ukhuluma ngetifundvo latitfolile kulomsebenzi webuthishela.
Umsebenzi wobuthisha usuke uthatha umsebenzi wocisha ufane nokuba ngumfundisi. Uma ufundisa labantwana bakopa kakhulu lokwenziwa wena kunalokhu okushoko uba isibonelo kubo la emsebenzini ngisho nalengaphandle baye bathi nje okusho ngithishela ngibona kuyikho okwenziwe ngithishela ngibona kuyikho make uthisha obesenza into ebheke eceleni vele labo bantwana bakubonile ukwenza bese balandela.
Labothishela labavaleliswako nguGugu Dlamini, Bongani Ndlangamandla kanye naLungile Masuku. Lobika-ke endzabeni ye-Eswatini TV nguThando Kuhle Mdluli ngisesandleni.
Indvuna yetemabhizinisi nekutsengiselana manqoba khumalo sethule ngalokusemthethweni umncintiswano wetemazinga walapha eSwatini Eswatini Quality Awards. Indvuna yethi lo mncintiswano uhambisana nalokushiwo nguhulumende kutsi ufuna emaswati yakhicitele kutsengisa ngaphandle kwakuleli. Indvuna yetfule lo mncintiswano emahhovisini elitiko layo eMbabane ngalesitsatfu.
Indvuna yemabhizinisi nekutsengiselana manqoba khumalo ithi ticelo tekungenela lo mncintiswano zotivele temukelekile. Indvuna yithi labahlabene kulo mncintiswano batawuchubeka bayochutselana nalabanye bosomabhizinisi lababuya emaveni lamanye esifundzeni lesendasi nelivekati le-Afrika.
Sifuna kuba i-export driven economy kusho ukuthi ke equality ngiyona letawusenda sibe nesiqiniseko ukuthi lokho lokukhicitela kangwane kuyathengiseka ngaphandle kwalelive bomakhelwane kulesifundzakathi seAfrika futhi nemhlabeni wonke jikelele. Lo msebenzi lona ke wentiwa ekubeni kaSADC tindvuna letibuke i-trade tivumelane ukuthi kufanele ukuthi kube nema-regional awards equality. Lama-regional awards equality atawulandzela kube nema-national awards equality. Bese-ke lona lohlabene kulelo live so uyaqhubeka ke uyochudzelana nalabanye kaSADC labahlabene emaveni abo sikubonakale ke ukuthi kugcina kuwina bani kule region.
Indvuna yithi lo mncintiswano ukhutsata abosomabhizinisi bakuleli ukuthi bakhicite lokungakhona ukuthi
kwemukeleke nasetimakethe letingephandle kwakuleli. Indvuna yethi bosomabhizinisi netinkampani abangenele lo mncintiswano njengobe kungenela kuvalwa nakuphela inyanga yenyoni. Kubhalisela kungenela lo mncintiswano kwendiwa ekhasini langcondvomshina lahulumende kanye nalelo lenkampani yahulumende lebuke emazinga i-ISWASA. Kanti kungenela lo mncintiswano kumahhala. Lo mncintiswano utawuse ubanjwa enyangeni yeLweti. Ndzabeni Eswatini TV kubika Themkosi Mavimbela nasikhumbuzo Dlamini sisembabane.
Muzimahlobo sengumphathi lomusha wenkampani leyakhadi ithako letakhadi natfota ka-Coca-Cola ikhonko. Mahlobo sewubongelwe yindvuna yetemabhizinisi nekutsengiselana manqoba akhumalo ngalesikhundla. Indvuna icele mahlobo ukuthi yakhulise le nkampani kodwa-ke itawukhona kuvula ematfuba emsebenzi lamanyenti.
Indvuna yetemabhizinisi nekutsengiselana manqoba akhumalo seyemukele yaphindze yabongela Muzimahlobo ngekuthi abekwe abe ngumphathi lomusha wekhonko. Indvuna ithi hulumende uyati ukuthi le nkampani inemthelela longakanani emnothweni welive.
Kulicapho lelikhulu kithi singemaswati kubona liswati lithatha lesikhundla lesi litawuphindze liphakamise umjeka welive emhlabeni wonke ngoba siyatuka ukuthi le nkampani lena yaka-Khonko inkampani lephasi kwa-Coca-Cola emhlabeni wonkana and ngilenye yetinkampani letinkulu sibili eveni. Nekunxusa-ke ukuthi nisasebenta niqhubeke kufuna emathuba ukuthi le nkampani ikhula njani and ekukhuleni kwayo icasha njani emaswati lamanye kuze ukuthi umnotho undlondlobale nekuthi-ke lapho nihamba khona nibe nemanxusa ethu kwekuthi nisho ukuthi kwenta ibhizinisi kangwane kulula kangakanani.
Mphathi lomusha ubongele lithuba wathi kukhona labakuphekako bayinkampani lokutawuletha imisebenzi eveni.
It's testament that there's talent in Eswatini for us to take over this prestigious position in a prestigious company, and I am following after your footsteps, Minister, so it shows that...
Mahlobo uthi lokucashwa kwakhe kule sikhundla kukhomba ukuthi emaswati analo likhono lekwenta tintfo. Uthi kukhona labasakwenda lokutawuletha imisebenzi lapha eveni noko kwamanje angeke basho ukuthi yini batakumemetela nasekufanele. Inkampani yekhonko ibalelwa etinkampaneni letinkulu lapha eveni letingenisa imali leningi futhi nasemnothweni welive njengoba imikhicito yayo ithengiswa ngaphandle kwakuleli. Le nkampani isafuna kukhula itinde lapha eveni. Tindzabeni Eswatini TV kubika Themkosi Mavimbela nasikhumbuzo Dlamini embabane.
Indvuna yelitiko letemabhizinisi manqoba akhumalo seyetfulele sive saseNzevane ikontraki yaka-Stefanotis Stocks letawukwakha-ke ifemu kuleya ndzawo. Indvuna yethi lesakhiwo sefema kubhekeke ukuthi sithathe tinyanga letilishumi kude-ke ukuthi ifike emaphethelweni. Kanti-ke ithi kubhekeke ukuthi kucashwe sive sakule ndzawo isakhiwa le femu.
Kubhekeke ukuthi kuqale noma ngunini kusukela ngeMsombuluko evikini lelitako kwakhiwa kwefemu yaseNzevane. Lokhu kukhulunywe indvuna yelitiko letemabhizinisi manqoba akhumalo ngesikhathi yetfulela sive saseNzevane kaMngomezulu ikontraki letawakha le femu.
Iyasonzela 100 million. Akusiyo umsebenzi lomncane. Bantfu bethu batawuvukela khona bayosebenza baphindze babuyele balale emakhaya. Bomake bafati bethu bavuke kakhe ayosebenza. Abobabe nabo basuke emakhaya babe angabonakali makuphela inyanga sekungona buye ekhaya.
Thandiwe Hlatshwayo lokhulumela ikontraki yaka-Stefanotis Stocks uthi batocinisekisa ukuthi yakhiwa ngendlela lefanele le femu.
Ngibohlakahla kokuthi umsebenzi sitawenda kahle ngendlela lemele ukuthi siwende ngayo. Sitawenda within le budget lesivumelene ngayo na micro project. Sitawenda ngalesikhathi futhi lesinikedwe sona.
Kulomsebenzi bekukhona nenkosi kaMngomezulu engwavuma inkosi Lubelo wesibili lekhulumele indlungulu yakaMngomezulu ibeke kanjena.
Siyendlulisa kubonga thina njengesive sakaMgomedulu leli silapha selibulini kwekuthi umsebenzi lofana nalo uhulumende nelive nengwenyama ubona ufanele ukuthi ugcine uhleli kulesive sakithi.
Nasakhiwo se-FM sesifike emaphethelweni kubhekeke ukuthi kucashwe eMaswati langedulu kwenkulungwane. Umbiko uhlanganiswe ngithembelihle Magutshwa eNzevane.
Umphathi wenkampani yelidlelandvongeni umfana Nkosi Lonkhokhela uthi umchudzelwano wembube marathon uhlose kusita nekukhutsata eMaswati kuthi asukumele indzaba yokushukumisa umtimba njalo njalo. Umfana Nkosi bekakhuluma ngesikhathi tinkampani tahlukahlukene tisekela umchudzelwano walonyaka. Umchudzelwano ke wembube marathon lotawubanjwa mhla ka-1 enyangeni yeMphala eminyakeni losetulo.
Inkampani letahlukene tiyachubeka nekwesekela umchudzelwano wembube marathon lotawubanjwa kulomnyaka losetulu. Akhuluma kulomcimbi umphathi wenkampani idlelandvongeni lokungiyona ilungiselela lomchudzelwano ukhumbute labo labesekela lomchudzelwano ngemali ukuthi kwaba sipho lesihle lesichamuka kuyo ingwenyama eMaswati ukuthi ahlale njalo ashukumisa umtimba.
Lo msebenzi wemarathon bekunene mbamba wekuthi sihlangane singeMaswati bonakala ukuthi siyakishukumisa. Ushukumisa ke impilo nangabe awutishukumisi, you can be sure ukuthi your days in this world mafishane kakhulu.
Leonard Nzimanze lochamuka enkampanini ye-Ilovo lokhulumele labo labesekele lomchudzelwano uchazile ukuthi kwesekela lomchudzelwano kuyindlela yabo yokubuyisela isiveni baphindze bakhutsate eMaswati ukuthi ashukumise umtimba.
We are joining hands by sponsoring this event. We are not only extending financial support but also showcasing our commitment in teamwork, resilience and physical fitness.
Imali lefakiwe lengu 130,000 malangeni ichamuke etinkampanini letifaka ekhatsi i-Ilovo, Inhlonhla kanye ne-Unifoods lokusho ukuthi lomchudzelwano walonyaka sewusekelwe ngemali lengetulu kwa-600,000 wemalangeni kwanyalo. Lomchudzelwano utawubanjwa mhla ka-1 enyangeni yeMphala eminyakeni losetulu. Tindzabeni teSwatini TV kubika Themkosi Mavimbela umbiko ohlaniswe nguFabrice Msonera eMbabane.
Licembu le-amawele lekungilo-ke boshampeni be-promotion eMbabane kulomnyaka selibuke kwakha umlandvo kulempela sonto ukuthi libuyele ekudlaleni esigabeni saka-Super League kwekucala ngca ngemuva kweminyaka le-15 nangabe-ke likhonile kuncoba umdlalo walo ne-Burning Spears ngelisonto emdlalweni lotawudlalelwa enkhundleni ye-Prince of Wales edolobheni eMbabane. Tingako lebe sikuphathele tona lomhla ekuseni sithathe isimo selitulo sibahlole emakethe sinabuya siqhubeke nehlelo.
What do you think the best part of traveling is? Is it the food, or is it the conversation, or is it the sights and sound? If you're ready to explore, we are ready to show you the best way how. We'll give you access to the best luxury getaway sites in the Kingdom of Eswatini, and of course show you vacation sites that suit your budget, because you do not need a lot of money to actually have a great time. Join us on the next adventure on Buhle Bethu, only on Eswatini TV.
Welcome back. Sakuvusela nawo losanza kuzivulela ehlelweni Kusile Breakfast Show besivetele ukuthi sithabe sikhulumisana nasibusiso Mnisi losuka khona enkampanini yaka EPA dokumele ukuthi kusukela mhla ka1 kuya kumhla ka10 EPA itawubuyisa umsebenzi noma ke umbukiso we-International Trade Fair. Kanti ke kulona mbukiso one lucky visitor will win the popular SUV the Kia Sonet. Kanti ke kungenela lo mncintiswano emaswati kubheka ukuthi avakashele yona i-Trade Fair aphinza avakashele netitandi baphinze babe nema-stamps batawafaka kuleli form labo nabangena kuwo lombukiso babeseke bawagcumsela khona eboxini bese ukuthi the winner will be announced during the EITF closing ceremony. Kanti kusenjalo nje na FNB naye has also sponsored 200,000 towards the competition through their subsidiary West Bank. Kanti ke Kia Motors are also sponsoring the remainder of the car's value to make this competition a reality. I'm joined via Zoom by a manager external trade Sibusiso Mnisi ka EPA. Asivusele baba Mnisi mhla ekseni siyabonga ukuthi i-trade fair yabuya lonyaka from the 1st of September to the 10th of September. Kusiniketa nje sithomise ukuthi ingabe lonyaka yini esingayibheka mhlambe yini esingayigada letabeyendeka kulombukiso.
No, thank you very much. Sivusele kuwe nebalalele emakhaya, babukele emakhaya. Thank you for having us in the program. Yes, indeed, the trade fair, as you have said, is back, and singasho nje ukuthi it's promising to be exciting, bigger, and we hope it will deliver in all fronts, starting from the 1st to the 10th of September, under the theme, let's see, endless possibilities. I think it's so there is a lot that we should be looking forward to. But more than anything, the focus is to promote trade, promote mass services between companies based in Eswatini, including government as well, and also foreign companies that will be coming through to exhibit. We anticipate we are going to have over 300 visitors. We can confirm now we are full in terms of the uptake exhibition stands, and also hopefully will attract more than the 40,000 that we have targeted in terms of visitors, because the event solely seeks to bring together the buyer and the seller, and also bring the consumer who is going to consume the products or the goods and services that will be on display. So you should look forward to a lot of things. Companies will be coming there to launch new products. Activations. We also look forward to issues of showcasing of talent. As you know, with e-trade fair is also looking at promoting the creative industries, and also looking forward to accessing government services. So basically, we will be providing, I would say, a one-stop shop, in terms of almost everything, for the entire 10 days of the event. You can come and see exhibitions, you can come and get services, you can come and be entertained. It's a lot of activities that will be on offer during the trade fair.
So kubuta nje baba Mnisi ukuthi nasikhuluma nje mhlambe ngawo emabhizinisi namakade inkampani leti tabe dikhangisa this year. I think uvetele ukuthi over 300 batabe bakhangisa ngemikhicito yabo. Siyayibona linganani vele mhlambe linani leti inkampani leti suka ngaphandle kwakuleli, ngakhumbe ukuthi kuleminye iminyaka siye sebabone baka Durban Tourism, siye sitibone tinkampani leti suka kubole Lesotho, Botswana. Ingabe this year nje nasibuka nje international companies ingabe vele mhlambe linani linganani?
I think, as we said, it's an international trade fair. So we have a lot of interest from companies and also governments willing to participate at the event. We've received, as you said, interest from South Africa, interest from Lesotho. We've received interest from Vietnam, from Indonesia, Taiwan, from the USA embassy. From the United States of America through their embassy here. We have received that interest in being part of the event, and it's going to be. It will take the form of being an international, trade fair. In that sense, it's trade and investment and other things. Also, we are receiving a lot of interest. In fact, it's confirmed a lot of tourism.
Unfortunately, ngobukeka kwangathi sosilahlekele lapha Mr Mnisi waka EPA ke manje uyasichazela nje kabanti ngawo umbukiso we trade fair ukuthi kutabe kwentekani ne line up nje entertainment kutabe kukhona labantu abasijabulisa khona ka trade fair so buyele ke phaba sachube nje achaza bemnisi bosachube ukuchaza nje ngayo yenza by tourism. I think nje ngaba kuva ukuthi ingabe vele mhlambe nasibuka yona I line up entertainment because labanye vele basuke bayele yona le entertainment ingabe vele mhlambe nasibuka yona I line up entertainment
Yes, entertainment is part of, I would say, the pillars of a trade fair in a sense that it's in two ways. We use it mainly to also, say to people that are coming there, don't get bored, but also be entertained as you move around to see Lama exhibitions. But also we use it to, in a way, also showcase our talent for our artists. In music, we'll also be having, fashion show. So we're giving them the platform with what do they have to offer, especially in promoting the creative industry. So we're going to be having gospel. I think we are going to announce very soon one of the biggest gospel Sundays. The main acts for that day. From South Africa, and also we're going to have Spring Bash. We're going to have spinning, kayak drifting, and also games for the entire family in terms of funfair games. If you want to do zip lining, bungee jumping, you want to go for go-karts, it's all going to be there for the visitors so that they are able to just, as they move around the exhibitions and they're also being entertained in the process. So we hope that it's going to be an exciting, event for the entire family that will be coming through.
Thank you for your time, Mr. Mnisi. Simakhulu kusiniketa nje sithombe sekuthi lo nyaka i-International Trade Fair itawubukeka kanjani. Mbukeli, that was Sibusiso Mnisi, who is the manager external trade ka APA. Sichazela nje ukuthi i-trade fair lo nyaka ime kanjani. Yaqala ke mhla ka-1 kuya kumhla ka-10 September. Sasisalkhe funa sibuya sidabe sikhulumisana na Chief Quality Systems Phindile Dlamini losoka khona etiko le tema business njengoba takhumula ukuthi itolo minister usukumisa ngalosemthethweni umncintiswano wema quality award. Siyabuya khona manje.
Let me tell you about my crush. Ngenzane inhlitiyo yami embibwakho njengesidanga.
Nkonjo yesiswati.
It is 3 in the afternoon. We are back in the living.
For men are so kind towards creation more than they even were to their own creator.
I am the greatest of this generation. They'll be calling me the girl who made poetry look cool, yo. Cool.
Welcome back. Sakubukela nawo lo sanza kusivulela besivetele usister besikhulumisana namake phindile Dlamini losuka khona etiko la ka commerce njoba nje indvuna yayo litiko minister Manxoba sokumisanga losemthethweni umncintiswano wabosomabhizinisi yeSwatini Quality Awards sibuka ke emazinga lapha emikhicito yetinkampani ukuthi tisakhicita imikhicito lasezingeni lelifanele yini vele sesivele naye lapha phindile atosiniketa nje sithombe sawo lomncintiswano ukuthi ingabe vele mhlawumbe kubaleka kangakanani ukuthi tinkampani tikhicite imikhicito lesezingeni lelifanele. Nkosi siyakumukela sama nje ukuthi ube nathi nomuhla ngumsebenzi lobalekile lona. I think nato nje tinkampani kuyatisita lokuthi tikhone kuba nalama products lasezingeni lafanele. I think nje kusiniketa nje just a brief background mhlambe nenhloso yawo lomncintiswano.
Ngiyabonga kakhulu ngicela kuvusela nami nakubo bonke babukele emakhaya siyalibonga leli thuba. Kusho ukuthi kafishane nje Lulu sikubita ngemncintiswano mbamba kuyi program lebesese igcina ke se inale mithelela yokuthi emaswati sesiyawawinisa. Ngumsebenzi lona lo waqala kaSadak lapho khona ministers of trade avumelana kokuthi onke emave akabe nawo lo mncintiswano la kwentele lokuthi tinkampani leti la kulesigungu sakaSadak tatane leto letikhona kokuhlangabetana nema standards kuze ukuthi sipromote itrade live ke laseSwatini wona umncintiswano libese luqala nga 2017 ngumnyaka wethu wesihlanu nje lona siwenda buhle ke bawo noma ema objectives sisawenda silive laseSwatini kokuthi live liyakhona noma uhulumende uyakhona kokuthi abadi bosomabhizinisi lanabo eveni labahlangabetana konetindzaba tequality sitawukhona phela ukuthi noma siphuma sikhuluma etindzabeni tabo export driven economy sikhulume ngato letinkampani ukuthi nathi sesinabo labakhona kokuthi bakhicite imikhicito lekhona kokuthi ingene noma lenawo emandla ekungena kulamanye emafu.
Okay, I think ngifuna sikhulume nje ngenzaba yebumcoka ukuthi tinkampani noma ke mhlambe amabhizinisi ayivaluation indzaba yokuthi vela ayawukhicita lo mkhicito losezingeni lofanele. I think nje kulenye tinkampani siyesibona ukuthi bese tiya awardwa ngema ISO 900 certificates. Ingabe vele mhlambe kudlala nzima yini lokuthi vele imikhicito yakho inkampani noma ibhizinisi ibe at par.
Litiko kulo lokushoko nathi sisho njalo sithi kumcoka kakhulu kokuthi inkampani imikhicito yayo leyendako iwalandzele ema standards kunebuhle ke lobuningi sitawucala nje ngekhathi enkampaneni inkampani lekhona kukhicita ilandzele standard tsite iperformance yayo iyehluka standard siyakusita kokuthi nalapho khona uba nema defects siwa minimize so your performance is improved when you are implementing a standard because basically what you are doing is you are doing one and the same thing and lokona noma lama mistakes akho ayancipha so that is the performance part lobunye buhle bekuthi inkampani implement ema standards ngiloko ukuthi uyakhona kokuthi kuloyo mkhicito wakho kungaba iproduct kungaba iservice uhlangabetana netithingeko tema customers akho ngalokuthi standard sikuniketa le room yekokuthi singaso sonke isikhathi uchecke lokho ukuthi vele kusengiko nlolo kwendako uphinze ubuyele ema customers akho uyova kokwe kuthi ngiwo kuphinze kubeke nebuhle bekokuthi ke inkampani yakho iyakhona ukuthi imikhicito yayo lo ikhicite ngekulandzela standard ikhone kungena nakulamanye emave ingabi nema barriers or leto micabo lengaba khona kokuthi kwakho akusafanani nalabanye akusaperform njengokwalabanye so you have that access yokuthi you can take your product anywhere in the world uma ngabe imeter standard itside.
Yeah, shothi kuvela amathuba vele ukuthi ukhona nekuthi kuthengisele letinye inkampani internationally. Mhlawumbe nasibuka nje the past winners ngifuna sikhuluma nje ngama past winners ukuthi kukhona yini mhlawumbe lokho kubalanzelela ukuthi basahamba ngale ndlela like kumele bahambe ngayo in terms of kukhicita wona lama products la ku standard.
Yes, tinkampani tiyalandzeleleka ikakhulu leto lesikhanza kokuthi setitfolile i-certification ngicabanga ukuthi asipha litfuba siyichaze tiyalandzeleleka kubuka lokho ukuthi lolothide uyakwenda yini sinabo nje nebufakazi lobuphuma kuletinye tinkampani lapho khona basatisa khona kokuthi sinele nje kuvela nathi uhulumende asirecognize sibona lizinga noma linani lema-customer lethu liyakhula sesibona naletinye tinkampani letingekho la kangwane ikakhulu kulabo lotawukhanza baphinze babe ma-winners nakasadaka bathi sesibona nalabanye sebayasibuta kokuthi singakuletha yini even labo ngako siyabona lokho ukuthi vele kukhona i-improvement leyentekako in terms of i-production ne-access to market yetimkampani.
Okay, sisakhuluma nje nge-improvement ngifuna nje sibuke vele mhlambe kukhula kwayo le program nje usho ukuthi i-program kahle kahle as you did mention ukuthi naqala ngeminyaka wa 2017 this year ni celebrate 5 years kambe vele mhlambe niyibonile in the growth from 5 years ago in terms of nasibuka the number of companies that participate bosoma business labancane niyababona enivele linani nabo linganani netinkampani nje mhlambe leseniketekile kukhona vele mhlambe lelo shintsho lenilibonako.
I-growth yinkulu kakhulu lesiyibonako kule program yethu kukune growth lesiyibonako yetinombolo nje uma siuqala lo mncintiswano tinombolo tethu betihleli kubo 30 kulomnyaka lophelile sicishe samthinsa 60 tikhula kakhulu kumbe kukhula bosomabhizinisi labakhulu kodwa ke nema MSMEs nawo noma bosomabhizinisi labancane siyayibona le growth but I growth lenkulu lenye litiko kumbe leli recognizeako it is in terms of the information that a company provides. Le khombisako lokho ukuthi lo muntu from 2017 to 2023 uyachubeka uyayisebenta lenzaba yequality kune improvement labeka ngakwendi itolo masicedza lama awards sibanikete ama feedback kusho ukuthi sikhanze kokuthi ngisengakalungi kahle nala khanza ke ukuthi ngeminyaka lolandzelako le growth lesiyibonako or the improvement ngiloko ukuthi so uyakulungisa so uyasifuna standard so uyafuna nekuya kaswasa futhi ayo trainer kusinika lithemba lokho ukuthi tindzaba te quality even in terms of the ministry now transforming the economy into the society, so to speak, into a society that is conscious of culture, of quality culture. We are moving a great milestone towards that.
Okay, so ananithi mhlambe nibuka standard vele nkose kahle kahle nibuka ene nje mhlambe unangaspeksela mhlambe ngebusiness noma inkampani yini kahle kahle lena lenibuka ko mhlambe sendela nje sama business nayo lo officer kungenela le program.
Yes, ngitawuthi nje fahla standard sitawufike sibuke kokuthi sine close ye management go standard management sibuka lokho ukuthi le nkampani yakho lekhicitako ingabe baphathi labayiphethe bona badivaluisha kangakanani letindzaba te quality. Sikubukelani lokho it talks to the sustainability of the company uma ngabe kutawukhanza kokuthi kwendiwa li officer lelichashwe ukuthi ngiquality bo manager noma ke labo labaphethe lenkampani abangenelani it's a red flag masibuka le standard ngobe kusho kokuthi utawukwenda adzinwe angayitholi le support bese kuyafa. Sichubeke le standard sibuke nje lokho ukuthi uyihandlisha njani le mikhicido yakho lokusho ukuthi ke lapho sekufuna usikhombise kokuthi ngikhicida emanti ngiwakhicida ngalendlela le ngiyawathesta futhi standard istakutshela kokuthi uma ngabe ukhicida emanti even laseSwatini kufuna abe ngilanjani lokho ke nako kumgcoka lokho ukuthi ukulandzele ngobe kuwo onke lama standards noma liningi lawo sifuna lokho ukuthi emaswati aphephe athi ukuthi athenga ini adlani. So that is a part of the standard. Standard istawuchubeka sikubute kokuthi another clause uwanetisa njani ema customer akho. kune clause nje lekhulumisa ukuthi wena customer akho uwanetisa njani. Kumgcoka ke lokho kude somabhizinisi lovule inkampani lo dikhicitelako wonke umfu ukhicitela ukuthi ayothengisa. And sithi for your business to be sustainable you must ensure ukuthi customers akho nisahambisana nawo. And bese ke kumbe lokunye lokubukwa standard ukuthi tikhona yini indlela nomelo tibekile ukuthi iproduct yakho ne service yakho ungayi improve njani after sowuvile kuma customers. So basically standard sikunika loyo mgwaqo loyo asikutshela ukuthi kwende njani. Kodwa nguwe lo sitshelako ukuthi mine lokhu ngidawukwenta kanje kungako nje standards are applicable to all sectors.
Okay. Kuma sisengasamaphethelwe nje ngosi sifuna kuva nje ukuthi this year ingaba nasibonje ama categories mekanjani kukhona langetekile kukhona endleni wasusile bese sichazela nje nangale applying process ne deadline ukuthi inini.
Yes, lo nyaka ema categories ethu ayafanana. Solo asithupha sina category 1 loan company of the year, category 2 sina service of the year, 3 product of the year, bese ka 4 sibana product of the year, then ka 5 sina category yethu ikhulumisa quality person or ambassador. Basically lapho sibuke umuntu loluswati longasikhombisa ukuthi so uyendile equality eveni wakhona nekusita labanye bese yekugcina icategory kuba ngileyo lebuka conformity assessment lokutawufaka ekhathi imisebenzi lendiwa ama laboratories ma inspection bodies nema certification bodies. Lo nyaka kulama category onke angisho lokho ukuthi letinkampani sidibuka ngebukhulu bato. Noma ngabe siku category 1 sidawubuka ema MSMEs odva siphinze sibuke ema large companies odva nekokuthi lama categories ethu aka compete nalenye akusho kokuthi uma ngabe company of the year so wine kakhulu kuna exporter of the year because the requirements la kule standard akafanani. Umsebenzi ke walonyaka singasho ukuthi sekuvuliwe kuthathwa kwemaform ayatholakala emakhasini abongcondvomshini bethu kulolu khasi la hulumende akhona ku www.gov.sz aphinze atholakale nakuyo iwebsite yakaswasa lengu www.swasa.co.za. Sivulile nje siyawuvala mhla ka 29 September nyalo bantu siya noma tinkampani sitivulele kokuthi tiwathole emafomu tigcwalise bese setiya sitfumelela ke electronically noma bawalethe eoffice khona ka commerce. Umsebenzi ke lomkhulu sibheke kokuthi siyawucela kumbe ube khona evikini lekucala noma lesibili la November.
Alright. No, kuyavakala smakhulu ngoba isikhathi sakho elisotivele nawo ukuthi deadline mhla ka 29 September so yenda siqiniseke ukuthi nawe uyayifaka leyo application yenkampani yakho noma ke ye business yakho. Asibahle emakethe sibuye ne traffic update.
Do you remember the spinning thing? This is us. This picture represents what we did. We were there when coronavirus wreaked havoc in our population. Together with other stakeholders, we formed the first line, controlling the spread of the unknown and unseen enemy of the people. Anxious ourselves, we collected dead bodies countrywide. At the time when no one wanted to come near dead bodies of loved ones, we did care for our fellow citizens. Thank you, the people of Eswatini and teams of first responders.
Sikwamukele ehlelweni kwelo muhle lesikhatsanyalo sithola i-traffic update. Sikuvusele emntolo eluhlelweni ngabe sikanjani siba emigwaqweni.
Ngikuvusele Ncumalo, ngivusele naye umbukeli wekusile breakfast show. Imigwaqo elivela kaNgwane sesiyibukile nyalo ekuseni imigwaqo leminingi yelive iyahambeka ikhona leyo lane sisikabeto kepha ngeke timende umshayeli ukuthi angakhone kufika lapho aphokophele kufika khona sikunakile-ke nyalo ekuseni ikakhulukazi emadolobheni elive linani lesimotolo seliqalile liyaphakama kwatise phela ukuthi abantu labaningi nyalo ekuseni bajagele khona emisebentini sithi basashayela abanakisise timpawu letibekiwe emigwaqweni ikakhulukazi litubane kwatise phela ukuthi ngilo esikhathini lesiningi leliyaye lisibangele tona tingoti letimatima emadolobha elive ahloliwe omane tibane temgwaqo tiyasebenta tonke ngalokufanele ngaphandle kwedolobha lelikhulu laseMbabane lakhona tibane temgwaqo letilapha ekuphumeni eSuperspa tingasebenzi tiveta nje umbala lobovu kuphela sithi nje bashayeli la tibane temgwaqo tingasebenzi khona abende isiqiniseko ukuthi bayamelana lofike kuqala ahambe kuqala kuze ukuthi sigweme kwenteka kwato tengozi sisesekhona khona ekhaya edolobheni eMbabane sitalati lesingizozisa road lesuka khona egarage la ka Total liye khona eCheckers leso sitalati leso siyathi ukuthi besilungiswa lokukhona nyalo emalayini asengadwetshwa kani lesitalati leso sisetshenziswa dimotolo letinengi kakhulu letingena khona ekhaya edolobheni eMbabane nyalo ekuseni nje bashayeli abashayelisane kahle lapho bekahamba ngesenqele agcine senqele sakhe nalo hamba ngesekudla kwatise phela ukuthi lomgwaqo loyo imotolo tiyahamba tibheke nganhlanye na usuka khona ka Total uyawufika khona lapha kule junction yase police station umgwaqo lomkhulu losuka khona ehekeni lasengwenya uye kaManzini lokufaka ekhasi na eMalagwane kude sikhinyabeto lesikhona nyalo ekuseni lubombo luhloliwe nalo lesingathanza nje kukukhuthatha kuto bobashayeli labasebenzisa kakhulu imigwaqo yaselibonjeni siyathi khona elibonjeni kwekuthi kunemaloli lathwala wona umoba laya khona eSimunye eMhlume nakhona eBig Bend sithi nje bashayeli bemaloli abende isiqiniseko ukuthi umthwalo wabo ukhungekile ungaze uwe ushaye imotolo letengako letincane kanti nabo bashayeli besimotolo letincane bayakhuthathwa ukuthi la khona kunemabhambi khona noma-ke kunema-speed humps abende isiqiniseko ukuthi baqaphelisisa kwatise phela ukuthi ngilapho la kuvama kwekuthi imotolo tabo bese setiyashayeka sisesekhona khona elibonjeni noma-ke imigwaqo yonke elivela kaNgwane siyanaka kulamalanga tifuyo noma-ke tinkomo tiningi kakhulu emigwaqweni yelive nyalo ekuseni nje sishe yonkhana lemigwaqo ukhanza lapha nalapha imfuyo ikhona eceleni kwemigwaqo sithi nje bashayeli abaqaphelisise ikakhulukazi ngesithuba sasebusuku ngoba lapho kulukunyana kuyibona leso silwane nangabe sisekhathi emgwaqweni nekuthatha-ke bafuyi kwekuthi abende isiqiniseko kwekuthi bayayibutha imfuyo yabo ngawo onke emalanga entsambama kuze kuthi kugwemeke kwenteka kwato tingoti ngesithuba sasebusuku ngale kwaloko Mnguni naye umbukeli imigwaqo elivela kaNgwane iyahambeka ngaphandle nje kwaleti lesenkishito sithikabeto kungaba kusisela yena umbukeli lusuku loluhle naloluphephile basetawusebenzisa yona imigwaqo elivela kaNgwane.
Simakhulu Mdolo, isikhathi sakho sibongeke naleyo update simfiselana nani lisuku loluhle nisachuba umsebenzi welive sibahlele emakethe sibuye netindzaba tesingisi.
We at Eswatini Television Authority are committed to observing the Eswatini Communication Commission's Broadcasting Code of Conduct.
Under the code, we are committed to broadcast news that is current, free from hate speech, accurate, balanced, and fair.
From politics to business, health, agriculture, courts, and global news, we bring you the latest updates as they happen, when they happen.
We cover all the sporting codes from the football pitch to the chessboards.
This is Eswatini TV News.
Welcome back. Thank you for staying with us. Let's take a look at our English news. Former National Director of the Eswatini National Emergency Response Council on HIV and AIDS, Nurture Kanya Mabuza, has been appointed as the new Principal Secretary in the Ministry of Health. According to the Prime Minister, Cleopas Dlamini, Mabuza was appointed by His Majesty King Mswati III on Tuesday.
In accordance with Section 74 of the Constitution of the Kingdom of Eswatini, His Majesty King Mswati III has appointed 2 principal secretaries who will serve in 2 government ministries. The announcement was made by the Prime Minister Cleopas Dlamini at cabinet offices in Babani.
Dr. Simon Zwane is transferred from the Ministry of Health to be Principal Secretary in the Ministry of Housing and Urban Development with immediate effect. Mr. Kanyagwezwe Mabuza is appointed to be Principal Secretary in the Ministry of Health with immediate effect.
Amongst the numerous challenges facing the Ministry of Health, the most urgent one is the shortage of drugs, especially in public health facilities. That is something that Mabuza has to hit the ground running in trying to arrest that issue. For Eswatini TV News, I'm Lincoln Kule with Vumungo Sinzinisa and Sfiso Ngumalo in Babane.
The Deputy Prime Minister, Senator Themba Masuku, says it is the responsibility of every Leswati to help raise children with discipline and inculcate the love of culture upon them in order to ensure that the culture and traditions of Emaswati are passed on to generations to come. Masuku was speaking at Elangeni High School's Culture Day.
Asiko ethu lemihambo ngikona kusenta sisekele bukhosi lobungibona sikhungelwe kuwo ngeke nje ubusekele ngesingisi ngeke nje ubusekele ngokungahloniphi ngeke nje ubusekele ngekungasihloniphi nemithetho uthi ungavuka nje ekseni uhambe uye lapha emoneni ubite abantwana labancane uthi anikhulume into lehlata fundzise bantwana tintfo letingafanele letingengangapha ngiyabekisa lokho ngulokungahloniphi.
The chairperson of Siswati Language Board, Ngosekati Thandi Khumalo, says a nation that abandons its culture and traditions cannot realize sustainable development.
Nasithi umuntu usive ngelisiko lakhe, aphinze abe sive ngelulwimi lakhe, aphinze abe sive ngendlela lembathe ngayo, aphinze abe sive ngendlela lenda ngayo tintfo. Pension yethu lengumliba loya embili sikufake lokuthi bayati labantwana imvelaphi yabo kuze kuthi kusasa noma ngabe sebaphumela ngaphandle bangabukhohlwa buve babo.
Elangeni acting chief Thembeni Magongo says every community member is duty bound to ensure proper upbringing of children.
Bantu bafika esigabeni la besaba khona ngisho ukukhuluma ngathi kwentiwa yini bengiqhubeka mina ngibamba imhlangano besiqhubeka sisebenza lapha RA abesinabafuna abantwana kufuneka umhlanga kuthiwe bayesaba labanye bakhiphe ngosatana qale kuthiwe khipha 80 gcina sekuthiwa hayi khipha nje 100 utameke uvala tikhala nenda njalo mhlonishwa labantwana labanye nje ngikhuluma nje bakhona khona la bayangiva ukuthi besigiya ngabo sisive semaswati.
As Elangeni High School hosts the Culture Day, the world is commemorating the United Nations International Day of the World's Indigenous People, which falls on August 9, and this year's theme is Indigenous Youth as Agents of Change for Self-Determination. On the news, I'm Mongwa Dube with 7LM Tetwa in Elangeni.
Minister of Commerce, Industry and Trade, Manxeba Khumalo, has officially launched the Eswatini Equality Awards. Khumalo says these awards speak to government's drive to have an export-driven economy. These awards have been launched at the ministry's boardroom on Wednesday.
Minister of Commerce, Industry and Trade, Manxeba Khumalo, says registration for entering for the Eswatini Equality Awards is now open. Khumalo says the overall winner will go on to represent Eswatini and compete regionally.
It is encouraging and it also encourages SMMEs to adopt and implement quality standards, practices, and management systems which ensure that their goods and services are competitive in the domestic and international market. From the consumer's perspective, these awards may act as a tool to give consumers the confidence that the goods and services they are purchasing are safe for the environment, safe for health, and safe for the life of the people and animals that consume those goods.
Khumalo says these awards push locals to produce what can compete at a global level. The minister has invited businesses and individuals from all sectors to enter for these awards as the deadline is at the end of September. He says entry forms can be downloaded from the Eswatini government website and that of the Eswatini Standards Authority, and this is free. The awards are expected to be held on the first week of November. For Eswatini TV News, Temgosi Mavimbela with Sikhumbuzo Dlamini, Mbabane.
Muzi Mahlobo is the new Conco Eswatini Managing Director. The Ministry of Commerce, Industry and Trade, through its Minister, Manqoba Khumalo, has congratulated the new MD. Khumalo has asked Mahlobo to drive Conco to new heights and open job opportunities for Eswatini.
Minister of Commerce, Industry and Trade, Manqoba Khumalo, has congratulated Muzi Mahlobo for his appointment as the new Conco Eswatini Managing Director. Khumalo says government is aware of Conco's contribution to the economy.
It is with great pride that we congratulate and wish Mr. Mahlobo very well in this new challenge that he has been given. We want to say the Kingdom of Eswatini, the government of the Kingdom of Eswatini is fully available to assist Conco and yourself as you execute this particular assignment. We understand the role that this company plays in our economy, but we want to challenge you to continue to grow the company as well as look at attracting other investments that might be part of your value chain to invest in the country.
The new MD thanked the new opportunity and said something is in the pipeline.
It's testament that there's talent in Eswatini for us to take over this prestigious position in a prestigious company. And I am following after your footsteps, Minister, so it shows that Swaziland does have talent, and we are fortunate that we are based in Eswatini. The government of Swaziland has been helping us quite immensely when it comes to any support that we require. And I want to assure you, Minister, that there are some projects in the pipeline that we are looking at to see how we can further bring all our some of our supply chain partners closer to Eswatini so that we can create some jobs.
Conco is one of the biggest companies in Eswatini and contributes immensely to the economy as it exports its product. This company continues to grow and cement its roots in the Kingdom of Eswatini. For Eswatini TV News, Temgosi Mavimbela with Sikhumbuzo Dlamini, Mbabane.
Head of Communications at Nurture, Sipesihle Nkwanyana, says Eswatini is amongst the top 5 African countries who have managed to eliminate AIDS. She says the country has achieved this goal in working collectively with many organizations and government's financial support in strengthening programs aiming to combat AIDS.
Nurture's head of communications, Sipesihle Nkwanyana, says the recent report by UNAIDS reflects that Eswatini is amongst the top 5 African countries to have eliminated AIDS. She says this has been achieved through the country's collaboration with many organizations and the government's efforts in providing financial aid in strengthening programs aiming to eradicate AIDS.
There are a lot of programs that were then initiated, prevention of mother-to-child transmission, HIV testing was heightened, and then it was also said that you need to test and then start treatment immediately, which would help, so that we don't so that those who are HIV positive do not actually transfer it to others, because that is exactly what HIV ending AIDS means, rather. It only means two things. It means that we do not want new HIV infections, first of all, and then we also do not want AIDS-related deaths.
Eswatini is one of the countries which was negatively affected by the outbreak of the pandemic, but the current statistics is a true reflection that Eswatini has combated AIDS as it managed to achieve over 95 global AIDS goal. Eswatini TV, Ampendulo Kumbi with this mover Shongwe, Mbabane.
The Royal Eswatini Police Service has destroyed 136 illegal firearms. The Chief Police Information Communications Officer Pindile Vilagati says 11 of the firearms were owned by the state and 125 were confiscated by the police. Vilagati was speaking at the Police Academy in Matapa.
Kuna umsebenzi leswenda njalo ngeminyaka kulandzela ukuthi kune SADC protocol lesigunyata singemave ukuthi kanye ngeminyaka lekunguJuly.
The Royal Eswatini Police Service is following the SADC protocol on the control of firearms and ammunition by destroying firearms which were confiscated and some were owned by the state. The High Court gave us the authority to destroy 125 firearms owned by civilians, while 11 of those were state-owned. We also destroyed 11,000 live ammunition. We would like to urge Amaswati who own illegal firearms to surrender them. As the National Commissioner of Police always advised Amaswati that it is safe for them to surrender those firearms. If they are not linked to any criminal activity, they will be free to go home.
It's 13 minutes after 7. Let's take a look at our sports news. In our sports roundup, we begin with Prince Lonkokela, who has reminded Amaswati that Imbube Marathon is an initiative from His Majesty King Mswati III to encourage Amaswati to keep active regularly. Prince Lonkokela was speaking during a sponsorship handover from different stakeholders to Eswatini National Provident Fund for the 5th edition of Imbube Marathon to be held on the 1st of October this year.
In our sports roundup, different stakeholders and companies continue to show support to the 5th edition of Imbube Marathon. Speaking during the sponsorship handover, Eswatini National Provident Fund Chief Executive Officer Prince Lonkokelo reminded everyone about the importance of the marathon.
Lo msebenzi wemarathon bekunene mbamba wekuthi sihlangane singemaswati.
Leonard Nzimanze from Ilovo Company, who spoke on behalf of sponsors, highlighted that their kind gesture is a way of giving back to the community by encouraging Amaswati to exercise regularly.
We are joining hands by sponsoring this event. We are not only extending financial support, but also showcasing our commitment in teamwork, resilience, and physical fitness.
Sponsorships handed over were equivalent to 130,000 emalangeni from companies like Ilovo, Inhlonhla, and Unifoods. In total, the sponsorships so far for this year's edition are standing at 600,000 emalangeni. Moving on to our international news, Bayern Munich have increased their interest in Harry Kane, who plays for Tottenham Hotspur in England, where they are willing to pay £94.6 million. On the other hand, Manchester City are looking to sign 25-year-old West Ham midfielder Lucas Paqueta, who is from Brazil. Manchester City is willing to pay £70 million. For Eswatini TV Sports, Fabisum Sonera, Mbabane.
It's 15 minutes after 7. We've come to the end of our English news. Let's take a break. We'll be back shortly.
WHO recently launched 2 reports on violence against children, including online violence. We are going to talk today about how to recognize the signs of violence and how to prevent it. Hello and welcome to Science in 5. I'm Vismita Gupta-Smith. We are talking to Sabine Rakoto Malala. Welcome, Sabine. Talk to us about violence against children. What do we mean when we say that?
The numbers around violence against children are shocking and unacceptable. We know today that 1 in every 2 children aged 2 to 17 have suffered from sexual violence or physical violence or emotional violence in the past year. That's 1 out of every 2 children in the world. We also know that 1 out of 5 girls is sexually abused before the age of 18, and 1 out of 13 boys is sexually abused before the age of 18. Again, these numbers are shocking and unacceptable. So the physical impacts, such as deaths and injuries, are terrible. However, there's also lifelong consequences that come with violence in childhood. We know that children that have suffered violence will suffer from more mental health disorders, such as depression, anxiety, suicidal thoughts. These children also are more at risk of engaging in risky behaviors, such as smoking, alcohol consumption, drug consumption, unsafe sex. These in turn lead to non-communicable diseases, such as cancers and cardiovascular diseases. And we also know that children that suffered violence in childhood are more likely to become perpetrators of violence later in life.
Sabine, can you talk to us about online violence?
So online violence is a real problem. And when we look at online violence, we're really looking at cyberbullying and sexual violence online. There are a number of important initiatives today collecting data about this global online problem. However, there are 2 important myths that need to be clarified. The first one is that violence is committed by strangers, otherwise known as stranger danger. In fact, we know that most of the online cyberbullying is happening by peers, acquaintances, family members. So these are the situations that we have to look out for. The second myth that needs to be clarified is that online violence is a problem on its own. In fact, in most cases, it's linked to face-to-face violence happening in real life. So, for example, cyberbullying in 3/4 of the cases is also linked to bullying happening in the playground or in the community. Or children that are sexting are often in abusive relationship with intimate partners.
Sabine, if 1 in 2 children is suffering from violence, then it's happening all around us. How can we recognize the signs of this violence?
Common signs that may indicate child abuse include, for example, unexplained injuries, fractures, or burns, children's behavior that changes, for example, becoming very withdrawn and socially isolated, or becoming very aggressive and violent. We also see children suddenly changing their hygiene, showing poor hygiene, children having a decrease in academic performance, and also, of course, young children below the age of 12 that are suddenly carrying sexually transmitted diseases. It's important to note that these signs on their own are not definite signs of child abuse. However, if you do have these concerns, please do report them to health workers, social workers, or your school workers.
Sabine, talk to us about how teachers, neighbors, grown-ups in the community can prevent this.
So for parents, caregivers, teachers, really anyone who's in contact with children, protecting them should be a top priority. Myself, I'm a parent of 3 children. They're aged 16, 14, and 10, and I follow 4 key pieces of evidence-based advice. The first one is open communication with your children. If you can establish that open communication, the day that your child is suffering from something, he or she will be more likely to come to you. The second one is establishing clear rules. This includes, for example, curfews, structuring your day, but more importantly, knowing always where your child is in terms of the rules. Thirdly, teaching your children about consent and personal body safety. This is important at all ages, 4 years old, 8 years old, 10 years old, 18 years old. And lastly, actively participating in your child's life. Again, if you're involved in your child's life, you will know when he or she is changing his or her behavior and is possibly showing signs of trouble.
So to summarize, the way we can keep our children safe is through education, vigilance, communication, and having a strong relationship with them. Thank you very much, Sabine. That was Science in 5 today. Until next time then. Bye-bye. WHO has been advising countries to use antibiotics rationally for decades now. Why is that? What is at risk? And how can we preserve antibiotics for our future generations? What can governments do? And what can you do? Hello and welcome to Science in 5. I'm Vismita Gupta-Smith. We are talking to Dr. Hanan Balki today. Welcome, Hanan. Let's start with what is at risk? Why has WHO been advising countries and people to use antibiotics rationally?
Good afternoon, Vismita. It's great to be back with you on Science in 5. I think if we just go back in history a little bit, in 1928, penicillin was discovered, which is the first antibiotic. So we're talking over 8 decades now of the first antibiotic. The problem is that these antibiotics were used to kill bacteria that cause disease to humans. However, these bacteria are smart enough that they find ways to escape the effect of the antibiotics because they want to survive. Now, so that's one part of the puzzle. The second part of the puzzle is that the antibiotics are critical for human health and also for animal health. So the modern medicine that we have the privilege of experience today cannot continue without effective antibiotics.
So Hanan, you're actually describing an apocalyptic scenario almost where people may not have the protection of antibiotics even in common injuries if we don't preserve their efficacy. Talk to us about the top 3 things that each of us can do to help that.
So I think the first thing that people can do is try to take antibiotics only when prescribed by your physician or your healthcare provider. That's the first thing. The second thing is complete the antibiotic course based on the instructions given by the clinician. And the third thing is make sure that you're not sharing your antibiotic with family or friends because it really needs to be given based on guidance, based on the specific signs and symptoms that each individual is experiencing. Certain viral infections, they really do not require antibiotics. When you do not complete your course of antibiotics, knowing that we have a bacteria that live on our skin, live in our gastrointestinal system. So exposing these bacteria to inefficient doses or incomplete doses of antibiotics only teases the bacteria in a way, and it allows it to develop mechanisms to become irresponsive to these antibiotics. So the risk is that we will start creating superbugs. We will allow for opportunities for these bacteria to become even stronger, and then when the time comes where we really need to treat them, we won't have the effective antibiotics to do so. Now, on giving antibiotics and sharing it with other people, you're actually putting them at a risk of giving them perhaps the wrong medication and also giving them the inaccurate guidance on how to use these antibiotics.
So Hanan, talk to us about what governments and organizations can do to preserve antibiotics for the future.
Now, this is also a very critical question because obviously people cannot solve this problem alone. And I think that's where the WHO has given a lot of attention to antimicrobial resistance. And we're really working hand in hand with 3 other critical organizations and many others as well, but those are the organizations for animal health, environmental health, and agriculture. And we work together to try to identify what are the best hygiene methods that need to be put in place so that, first of all, animals and humans as well are not exposed to infection so that there is less need for using antibiotics. And this is not an easy task, but we're doing our best to move forward on that. What we're hoping also when we work with governments, we have put in place with the member states certain national action plans so that they can have the right bits and pieces that need to be done in the healthcare system, in the agriculture system, in the environment to make sure that the hygiene and the cleanliness of the environments where we eat and live and where the animals are raised and where we eat our food is actually clean. And we minimize to the maximum the need to use antibiotics. So that's one critical thing. One other critical thing is making sure that people stay as healthy as possible. A good example of that is making sure that people take their needed vaccinations, and that also reduces the load of infections that will require antibiotics in general.
Thank you, Hanan. That was Science in 5 today. Until next time, then, stay safe, stay healthy, and stick with science.
Tinso tethu tivikelwa
All right, it's 29 minutes after 7. Welcome back. Thank you for staying with us. Let's talk about asthma, which is a major non-communicable disease affecting both children and adults, and is the most common chronic disease among children, according to the World Health Organization, which says that asthma affected an estimated 262 million people in 2019 and caused deaths of 455,000. But again, most asthma-related deaths occur in low and lower middle-income countries, where underdiagnosis and undertreatment is a big challenge. World Health Organization is committed to improving the diagnosis, treatment, as well as monitoring of asthma to reduce the global burden of NCDs and make progress towards universal health coverage. Let's talk now to Dr. Chihaye Frederick, who is a general practitioner with the clinic group. He joins us now on a video link. Doctor, a very good morning. Welcome to the program. The World Health Organization just quite concerned about the numbers around, asthma with regards to the deaths that, we get from asthma. But they clearly articulate that it is because of diagnosis, particularly on low and lower middle income countries. I think before we get into that, what is asthma really?
Good morning, and thank you for having me on this program, but also giving me an opportunity to elaborate on this very important topic. And thanks for coming up with initial epidemiological explanation, just to give context regarding how important this situation is. So coming to what asthma is, essentially it is a condition that causes swelling, narrowing, and also excessive mucus production in the airways. Essentially, that's what asthma is.
What causes asthma?
Well, when it comes to cause, up to now, the scientific community has not yet sort of put a finger on what causes it. But what we do know is there's a complex interplay between genes, the environment, but also a bit of nutritional factors as well. So to put it simply, most of the asthma is genetic. Some of it is caused by other conditions in the environment.
It affecting, or rather, affecting an estimated number of 262 million people in 2019. That's by World Health Organization, by the way, which also says that it caused deaths around 455,000. I think that begs the question, a worrying question, is it contagious?
Yeah, certainly that's an important question really to delve into. So asthma is not contagious. I think that's a bit of a relief to all of us, knowing that this is not an infectious condition. But like I have said, there's a lot of genetic interplay. So it can be passed from sort of a parent to children. It goes along the family tree in a way.
Interesting. And then what are some of the common triggers for asthma?
Yes, so since most of it is genetic, about 80% of asthma is sort of allergic. So the common triggers would be things that irritate the airway, most of the environmental factors. So we're talking about things like dust, pollen, other viral infections. For example, recently we've had several outbreaks of COVID, influenza, even simpler respiratory viruses can trigger asthma attacks. But we also have other things like medication, for example, aspirin, that can also cause an asthma attack as well. It is also important to also just illustrate that those that are living with asthma, especially in the environment they stay in the household setting, if there is somebody that smokes, or, for example, or use of strong perfumes, all those can trigger an asthma attack as well. Thanks.
What about low temperatures? We're experiencing quite, tricky weather patterns these days. A lot of low temperatures unexpectedly that are very abrupt. Do they also trigger asthma?
Certainly, and that's a very important one as well. So there is a specific type of asthma also called cold-induced asthma. So like you rightly said, with this cold wind that goes into the airway, it irritates the lining of the airway and can induce an asthma attack as well. So that's very important. Also, just to highlight that exercise sometimes can induce an asthma attack. Sometimes we do see people that go jogging early in the morning. We usually just recommend that if one is asthmatic, they need to wait when it's a little bit warmer to go and exercise.
Then the World Health Organization also clearly states that lower middle income countries have a lot of asthma-related deaths that occur in those countries. I ask myself for a situation in Eswatini, what's the current picture right now when it comes to our diagnosis?
Yeah, so when it comes to diagnosis at the moment, like what is in practice is asthma is diagnosed by what we call pulmonary function tests. So there are certain tests that have to be done to just check how the lungs are functioning, the airways are functioning. We don't always find that in practice. Sometimes we use what we call clinical diagnosis. So this is based on the common symptoms of asthma, which are usually coughing excessively, usually a dry cough. There's also wheezing. This is sort of a whistling sound that comes out when one is breathing out, but also shortness of breath or chest tightness. So sometimes doctors will use these symptoms to sort of diagnose asthma. But the gold standard is to use these tests that I talked about before called lung function tests as well. So locally, we do use mostly clinical diagnosis to diagnose asthma. But you like you rightly said that in the low to middle income countries, the death situation is actually worrying. So it is very important also for us as healthcare workers to make sure that we diagnose as many cases as we can so that we manage these conditions. Thank you.
We also need some clarifications on some of, the most common narratives around asthma, particularly with how it's treated really. Is it true that asthma inhalers or sprays are addictive?
Yeah, so thanks for bringing that up. Actually, we do encounter that quite a lot in practice. We do have some people that have reservations, especially against these inhalers. So there's this myth and belief that once you start on inhalers, then it's addictive. You have to be lifelong. So essentially, inhalers are not addictive. Inhalers basically, I can call them devices basically that have got medication inside that comes in form of a vapor or a powder that goes into the airways. So they are not addictive in any shape or form. However, these medications are very important in expanding the airways. Just to show, like how important it is, I'm going to illustrate how the airway looks so that we can just maybe give a bit more insight into that as well, because this is really important.
You open your illustration, doctor, just quickly, how important is it, to just the safety and dangers of using traditional medicine to cure the disease? It seems like it's very scientific by the way that you're explaining it, but there's still the belief that it can be cured traditionally.
Yeah, so that's really important. for us to talk about this. What we know is, as of today, asthma is not a curable condition. It is something that can be treated, managed and controlled, but it is not curable. Once somebody is diagnosed with asthma, then they do have it lifelong. Of course, one can live comfortably without triggers and flares as well. But it's very important to know that the condition is not curable. So the issue of using traditional medicines, I would say people really have to consult their doctors and healthcare systems as well. Thank you.
Believe that they can, ease the situation through prayer?
Yeah, I do understand that, and I know there's a lot of sensitivities around this issue as well. But what we do encourage is once somebody has got those symptoms suggestive of asthma, they should seek healthcare as soon as possible at the nearest health facilities, see their doctors. Yeah, thank you.
I think we have just a minute. Doctor, if you could just quickly go through your presentation. What do we see on screen right now?
Thank you so much. So on the right hand of the diagram that is here, we can see what looks like the airway of somebody who is asthmatic. So essentially what we have here in the center that looks like a tree, this is what we call our airways. It branches into smaller tubes called bronchioles. So as we breathe in and out, these tubes pass the air in and out into our lungs and the rest of the body. So what happens is if one has got a normal airway, it looks like the one that is on the right side of that diagram. You can see the muscles are relaxed, there's normal lining and normal amount of mucus. But when one is asthmatic, when you look at the left side of that diagram, what we see is the airway is swollen, the muscles are tightened, and there's excessive mucus. So this makes it very difficult for one to breathe in and out, especially out, causing the wheezing, coughing, and the chest tightness. So the issue of inhalers comes here. So the medication that we give, there are two types of inhalers. There are others that we call bronchodilators. Basically, they just open up this. The muscle relaxation stops and the airway gets a bit larger. And there are others called preventers that also one inhales. So essentially what happens with an asthma attack, it looks like the one that is on the left side of the diagram. But when you look on the right side, it would be a situation after we have treated the individual in a hospital setting. So I just wanted to illustrate on this point, but also just to show the devices I had talked about that we use to diagnose asthma. So one is asked to breathe into this tube, and we do some measurements as well. But also just to show different types of inhalers that are on the market. I'm not going to go into the details, I know we're out of time. But essentially, just to illustrate the point that there are different devices and medications that can help one who is living with asthma. Thank you.
Awesome, Doctor. Thank you. And I think just to appreciate, our viewers can also rewind this on YouTube and take a look at those images that you've just shown us on your presentation, just to know which devices to use and which ones not to use. Thank you so much for your time this morning, teaching us about asthma, which is a major non-communicable disease according to the World Health Organization, affecting both children and adults, and is the most common chronic disease among children. Let's go for a net break. Stop here.
Ngabukela ke washa umkhukhu every Sunday at 3 p.m.
Welcome back. Siyakuvusela nalo Sanza kuzivulela. Thank you for staying with us. Lesikhathi sidawubuka nje umbiko lesikhona enhlanganweni yangamhlaba yetempilo World Health Organization. Babe nemhlangano kwenetinthatheli kuva nje kusiniketa nje update on the latest health issues. Let's take a look.
Thanks for taking my question. It's a question about the spread of mosquito-borne diseases in places that they didn't usually occur, such as dengue in several European countries. I have two questions. The first one is that given that these countries don't usually have to contend with these diseases, is there concern that they don't have the systems in place to monitor and treat them, as well as eliminate the mosquitoes themselves? And then on the elimination question, I'm wondering if the WHO is recommending specific actions for these countries. Should people start putting out mosquito nets, wearing insect repellent? Should countries start implementing sort of large-scale campaigns to eliminate these mosquitoes? Any comment on that would be really useful. Thank you.
It highlights a lot of challenges that we are facing right now with the way in which we are living on this planet, the drivers of spillover and changes in climate in terms of how some of these mosquitoes, the geographic range of some of these mosquitoes moving further north, further south, placing countries at risk for diseases that they haven't had experience with, as you've pointed out in your question. And so the world in which we live in, we need to take into account these changes and be able to prevent and prepare and respond to the threats that we face. You mentioned diseases spread by mosquitoes, but this is a risk for all emerging pathogens with epidemic and pandemic potential. And one of the reasons why I'm going to link back to COVID for just a moment and what the DG said is that the systems that have been put in place and that have been enhanced, particularly over the last 3.5 years, but have been working to advance for many years, are applicable for diseases like dengue, for diseases like cholera, for diseases like Ebola, and the next respiratory pathogens. So yes, sorry, I'm looking at the wrong camera. The countries do need to utilize the different ways in which, and the different types of interventions for prevention, one of which is vector control, looking at what are the mosquito populations that are there, and how could vector control be applied. But a lot of this is also about other uses of tools that exist. In instances where we have interventions like medical interventions, therapeutics or vaccines, depending on the pathogen, we need to be able to prepare for that. And countries have worked incredibly hard over the last several years to build those systems and strengthen those systems for COVID, but those could also be used for other diseases. So others may want to comment on this specifically about dengue, but in short, of course, countries need to look at what are the risks to their populations. They need to look at how the changes in climate change and the dynamics of spillover and amplification are changing and prepare for that.
Thank you. Dr. Brian, would you like to add something?
Yes, thank you very much for this very important question indeed. And WHO is recommending member states to now adopt a framework that we call HEPR, Emergency Preparedness and Response Framework, which include 5 categories of intervention and capabilities that countries need to strengthen to face those emerging disease or new threats. One, and we call them 5 Cs because it's a collaborative surveillance, so we encourage countries to increase surveillance, and in particularly for vector-borne disease, it's important not only to monitor the disease in human, but also see if mosquitoes are infected and able to transmit the disease. We also, the second C is community protection, and it includes all the measures that are important to protect communities. So of course it's information, and as you mentioned, information on the measures that can protect individuals. So in case of vector-borne diseases, mosquitoes, repellent, and bed nets, and so on. But also all the measures that will also make the environment safer. For example, using insecticides to reduce the population of mosquitoes. And the third C is clinical care. Because so it's very important to have a good health system and to be able to take care of patients. And for some of these diseases, we do have treatment, either antivirals or for cholera, for example, we have antibiotics as well. So we encourage countries, of course, to make sure that depending on the risk they may face, they need to also be ready to have those treatments and or vaccines in hand. The The fourth C is access to countermeasures. And here we include in countermeasures, of course, the vaccine, the treatment, the diagnostics, but also any other measure that could be useful to treat patients. For example, oxygen in some cases, and this was the case for COVID-19, for instance. So it's very important that countries also look at their supply chain and making sure they can access those countermeasures in a timely manner, should they need them. And the last C is the coordination, because any of these outbreak or new disease will require cross-sectoral coordination. And so this coordination needs to be scaled up when there is a crisis, but ideally it has to be prepared and enhanced before the crisis. And that's why we call countries to really have this approach, cross-sectoral approach. And one good example is what we call One Health, which is cross-sectoral coordination between animal sector, human sector, and environmental sector. Thank you.
And I just want to add specifically in relation to the likes of dengue, and people make that comparison because people know that word dengue virus or dengue hemorrhagic fever, and we have malaria. But it's important to recognize that there are different mosquitoes that transmit those two diseases, and they have very different behaviors. The Aedes mosquito that transmits dengue and also transmits yellow fever and other viral diseases is a day biter, not a night biter. So the interventions we have in place for preventing malaria in kids are very often bed nets at night, but they don't work as effectively when the mosquito transmitting the virus is biting during the day. What's interesting is that that same day-biting mosquito is quite happy to continue to bite into the night if an area is well lit. Well, you're talking about where people are densely populated, where there's poverty, where there's the Aedes aegypti, where the mosquito doesn't breed in the normal rivers we see. It actually prefers to breed in areas where humans leave standing water, in upturned cans and upturned tires and upturned sort of the waste of modern life. So we are creating this problem in the main by creating and driving the production of breeding sites, by putting people together in areas of poverty, by allowing those vectors to breed, and then the virus emerges. So very often emerges after flooding events or after rains. But in effect, this is about human behavior as much as it is about the behavior of the actual virus or the behavior of the vector for the virus, which is the mosquito. Climate change is changing a lot of that too, because it's changing the zones in which these mosquitoes can survive and breed. It's changing characteristics associated with the virus itself. It's changing human behavior. It's changing human migration. So what climate is doing is driving all of those factors in a way that's very unpredictable. And the outcomes we can't predict very well. But we do know that where dengue occurs, we do have recurrent dengue in many countries, and we can prepare for it. It's a very treatable disease with very simple clinical interventions, but they have to be done properly. But the intervention to prevent dengue is very much at community level. There's no high-tech solution for dengue. Dengue vaccines aren't available. We don't have a magic wand. But cleaning up breeding sites and using larvicide at breeding sites is highly effective. But that involves investing in communities. That involves dealing with peri-urban slums. That involves dealing with the people who are undocumented and unregistered in society. That means dealing with poverty. So there are solutions, but there is no high-tech solution around the corner for something like dengue. Dengue is a symptom of our society. It's a symptom of the way we make people live. It's a symptom of poverty. And it's a symptom of the lack of application of simple interventions that are easily affordable in the right place at the right time.
My question is about COVID vaccinations. The countries in the Northern Hemisphere are soon to, start to give people new boosters. And I'm wondering at this point, given that we have used these vaccines in multiple rounds, whether there's any scientific rationale for putting a limitation on what vaccine you can get. Currently, for instance, in the United States, you cannot get a Novavax vaccine if you, unless you previously were vaccinated with Novavax, pretty much. There are a few exceptions. Is there a scientific rationale for that? Nobody cares if I got a Sanofi flu vaccine after getting a GSK flu vaccine. Isn't it time to just treat these all as equal vaccines?
So we have, first of all, we have provided recommendations on what you're referring to, which is mix and match of vaccines for COVID. And our recommendations are that for all of the vaccines that are WHO, EUL, in other words, the vaccines for which we've done a review and for which we have evidence, that these can be mixed and matched in terms of which dose you get for a booster dose and which dose you get for a primary series dose, with some limited exceptions. And I can refer you to the recommendations, but they have to do with the order in which and which vaccine you get when we're talking about the inactivated vaccines. But for the remainder of the vaccines, although we don't have clinical trial evidence or observational data on every single kind of combination of mix and match schedule, what we do know from the evidence that's available is that there is probably some increased benefit for some of the combinations of mixing and matching, and that there's no evidence of having harm done or having a reduced performance of the vaccine. Now, that being said, different countries have certain policies around how they use the vaccines, and that generally has more to do with the supply that countries have and the availability of managing that supply. But as you say, we do have, our recommendations are that mixing and matching is acceptable and leads to good performance of vaccine regimens. The most important thing is that for those people who are recommended to receive additional doses, that they go ahead and actually get them. So the most important thing is to actually get the dose. And that's particularly for those who are in high-risk groups, where that additional dose, even though it's of marginal additional benefit, still for those who are at high risk, really has a significant contribution to make to protect from serious disease. Hope that answers your question.
Our committee strongly recommended that member states take a look at the vaccination recommendations from SAGE, the vaccine committee of the WHO, and make efforts to reach those groups at increased risk of severe disease, and make sure that they are boosted and receive that extra benefit of protection against severe disease.
Right, there was a press conference with the World Health Organization just talking on the importance of vaccination and just, overall world health. I think it's quite important looking at Inzaba year vaccination. In fact, we were talking to the Minister for Health yesterday, Liz Ngosi, who spoke on the fact that we are on the process of building 2 more oxygen plants in the country, courtesy of our Global Fund, of Global Fund. She stressed the importance of having adequate oxygen plants in the country, having seen what happened when COVID-19 wreaked havoc in different economies around the world, but uniquely in Eswatini, where satfolakala ukuthi side kahle vele oxygen plants sinzaka ye pandemic preparedness ekutheni should these incidents hit us once again akusithole silungele kungasitholi nje sisenza weni lapho khona sesigijimela etulu, which is an important proactive approach by the Ministry of Health, I think.
Yeah, I think lokuyindlela abakhulume ngako lapha kulomhlangano sifisa there were questions lababuta wona ngetindzaba nje tema health issues, and one of these diseases mhlambe lababude ngawenza by cholera outbreak. Sizokhumbuka ukuthi a few months ago kube nemave lambala nje lapha eAfrica la because kunema outbreak cholera disease lokufaka khathini nelive lapha makhelwane South Africa lapho khona ePretoria bekubika ukuthi kunebantu mhlambe labati khanzisa banathe mandi engakahlandeki kahle lokubangela ukuthi babese-ke baba nalesifo lesi, and also nje kube nema-deaths rather kanye nema-confirmed cases lawe over 20 confirmed cases esifo se-cholera khona e-South Africa. I think nje lokunye labak-emphasize kwasifiso WHO yenza ukuthi vele senesiqiniseko sokuthi we drink clean water amanzi lahlantekile, singanathi nje amanzi langakaphephi. And also laba indzaba lakhuluma ngayo indzaba ye-malaria njengoba nje kulamanye amave vele kushisa kakhulu kunetimbuzilwane. I think nayo bayigcizelela indzaba yokuthi vele asiphephise. I think kube ne-question nje le bayibudile indzaba yama-nets ukuthi vele ayasida yini vele. I think kubalekile nokuthi nawe nje umbukeli also watch these videos aka-WHO laba waphemvulako mayelana netifo letikhona nje emhlabeni lesikhungethile.
Yeah, we hope that onke amave emhlaba njengoba it is a World Health Organization atakhona lo ukuthi ayibambise World Health Organization ekutheni i-global coverage yato tonke letindzaba labati khulumisako tholakale ukuthi sime kahle kube bede kugula lesikhanza sekuthatha imiphefumulo yebantu njengoba nje besikhuluma lo mhla nge-asthma sikhuluma ngama-millions and millions of lives that are taken by kugula kwe-asthma, particularly nje stat sa 2019 that took millions and millions of people's lives. So we hope that countries, economies are adhering to these recommendations by World Health Organizations. We've come to the end of our program for the day. We will see you again tomorrow. Have a good day and stay safe.